Hello and welcome to the channel and to the video. In today's video, I want to talk about how you know if you have PCOS. You may have come across PCOS and the symptoms associated with it, and you may be thinking that it's possible that you have it too. So in today's video, I want to talk about exactly how you know if you have PCOS. It is important that you know if you have PCOS or not. The sooner you find out if you have PCOS, the better. This is because along with a PCOS diagnosis come with it many symptoms but also many risk factors. So the sooner you find out whether you have it or not, the sooner you can start treating it with the appropriate approach. So while there is no cure for PCOS exactly, there is a way to manage it and there are treatment approaches. So do not be afraid or feel that you are stuck with this condition for the rest of your life. So while there is no cure, however, you can manage this condition through steps that I've made in a previous video that I can link in the description box below and I'll include right here for you to go check out. They are my 5 key strategies to managing PCOS. So what is PCOS? PCOS, polycystic ovarian syndrome, is a common endocrine disorder affecting 5 to 10% of women of reproductive age. So PCOS is a condition in which the hormones are imbalanced, and women with PCOS have high levels of androgens. So what causes PCOS? There's no clear cause of what causes PCOS. This is because there are many types of PCOS. However, the most prominent cause of PCOS is insulin resistance. Insulin resistance is when the cells in the body have trouble absorbing glucose in the blood. In turn, there's a buildup of sugar in the blood. I will discuss the other causes and types of PCOS in another video. So, what are the symptoms of PCOS? Many symptoms of PCOS, and they usually become apparent in the late teens, early 20s. Many doctors lack the knowledge and therefore fail to diagnose PCOS correctly. This may be due to the fact that they try and treat each symptom separately rather than getting to the root cause and treating it holistically. As I mentioned, there are many symptoms associated with PCOS, but you do not have to have all of the symptoms to have PCOS. Symptoms include irregular periods or no periods at all, infertility or trouble getting pregnant because of a lack of ovulation, hair loss or hair thinning, weight gain or trouble losing weight, acne or oily skin, dandruff, excessive hair growth. As I mentioned, there are many symptoms associated with PCOS, but you do not have to have all of the symptoms to have PCOS. Symptoms include irregular periods or no periods at all, infertility or trouble getting pregnant because of a lack of ovulation, hair loss or hair thinning, weight gain or trouble losing weight, acne or oily skin, dandruff, excessive hair growth, skin tags or dark patches on the skin, and cysts on ovaries. However, this is not always an indication of PCOS. So what are the tests to establish whether you have PCOS? There is no single test. Your doctor may follow these steps and tests to examine whether or not you have it. The doctor will ask you about your medical history. So about your menstrual cycles, your periods, any health issues you may have, and about your weight. The second test your doctor may do is a physical exam. So here your doctor will measure your body mass by examining your body mass index, your waist size, and your blood pressure. The third test, which is very, very important, is a blood test. It is important that your doctor undertakes a blood test to examine if you have PCOS. This is because in order to establish whether you have PCOS, you have to check your hormones. So your doctor will check hormones such as your testosterone, your estrogen, your thyroid and insulin. I can link the test that your doctor should do in the description box below. The fourth test that they will do is an ultrasound. Now, an ultrasound will check your ovaries to establish whether you have cysts. The cysts are not actually cysts. their follicles. This is a result of having no periods and not ovulating. Do not rely on the ultrasound to establish whether you have PCOS. Make sure you get the hormones tested. Make sure you get blood tests to test your hormones. That is the best indication of whether you have PCOS or not. So while there is no cure for PCOS, it can be treated and managed, and you are one step closer to taking back control. What I want you to do now is I want you to watch that video of my 5 key PCOS strategies for taking back control of PCOS. I also want you to go back and watch my PCOS Diet Talks playlist, so go check them out. I also have that in the description box down below. Thank you so much for watching. I really hope this video helped you out. If you have any questions, leave them in the comment section down below, or email me at info@pcosandnutrition.com. Comment down below I am PCOS strong to let me know you watched this video and to empower you that you are in control. Don't forget to give this video a like, share it, and please subscribe.